Hi, my name is Nicola Heady, and I'm currently in the last year of my PhD studentship on the Data Science, Health and Wellbeing pathway. I'll be talking briefly today about how data held in the health and social care sectors has the potential and capacity to create a more real-time positive impact for our most vulnerable groups in society. So what is data science and big data? I once read this comment in a blog, and for me it explained it perfectly. Big data is like the earth developing a nervous system, the ability to gather, analyze, and react to whatever is occurring in the world in real time. We are all now living and breathing walking sensors thanks to our general interactions with technology. And data science is the method that we use to collect that big data. Everything we do in our lives is virtually recorded and logged somewhere. Now, some may be cynical and immediately go to the Big Brother scenario, and to a lot of us, it will just be a load of numbers and digits that really mean nothing to us in our day-to-day roles. We basically input that data and then it goes somewhere. But what many of us don't know is how valuable this data is. What if I told you that it has the potential and capacity to 1. Improve the overall well-being for vulnerable individuals that so many of you support every day, 2. Unite the data and knowledge held between health and social care sectors, which has often been suggested to hinder effective service provision for these vulnerable individuals, and 3. Provide government, policy and stakeholders with quicker, viable, quantifiable information that could enhance and improve service provision. Would that make it a little bit more interesting? So I'm hoping at this point, as I cannot see any of you, that you are all nodding. So I will carry on. Most of us know that big data is already being used as a research method that can produce fast, effective information real-time to deliver a product or service to us as commercial consumers. But as a consumer of health and social care services, attaining this information in research to be able to deliver a new product or service can take years, if not decades in some circumstances, particularly for those hard-to-reach vulnerable groups that are listed here. Research is often difficult to attain, analyze and interpret due to complex barriers such as consent, frequency of moves, anonymity, and all these barriers hinder our ability to attain information and data that could help and support these individuals. One particular group that is often perceived as difficult and hard to reach in research is the care experienced child, who is often labelled as the looked after child. The research that has been conducted so far unfortunately depicts a very bleak future for many of these children. Even when they are embedded in services, they are still predicted to attain these poor health and social outcomes. So how can big data help improve the outcomes of these vulnerable children? Well, in simple terms, we now have the capacity to be able to link health and social care datasets held in places like the Secured Anonymised Information Linkage Databank, which we normally refer to as SAIL. This can attain information in a matter of hours rather than having to wait months or years. Linking the data can start to provide us with a timeline and more holistic picture of these groups that can be further explored in depth. So, as a snapshot mock example here, if we were to explore the mental health of these children, linking that data can tell us very quickly, firstly, how many have a mental health disorder, and then we could look at what are the disorders. So from the outset, we know that a number of these children will require future mental health services. And we know that ADHD is a neurodevelopmental disorder and is lifelong. So we immediately know that there is a potential that these children will require health and social care services in the future. It can also tell us what primary and secondary services they have been using in the last 3 years. What health services did they use? What social care services did they use? And for how long? What were the reasons for referrals? Did they attain their GCSEs? Were they excluded? And when? And why? Remember, this process can take hours and days rather than having to wait months or years. So from just this very simple diagram and process, you can see that we are able to attain a much more holistic, wider picture of information for these children, but at the same time, attain a more detailed, quantifiable picture that can be utilised to inform, affect or fund service provision in more real time to meet the needs of these children. The questions are endless. We are still at the tip of exploration into how we can utilise data science and big data, but this is where it could get really exciting. We can use data banks like SAIL to explore not just the present, but past and future data from cradle to the grave. Data science and big data can even explore wider social and health determinants that are listed here. It could potentially identify patterns or recurring factors that might at least contribute to the understanding of intergenerational cycles of poverty, substance misuse, or even disability. So to sum up the benefits, it can link health and social care data to provide quicker and quantifiable results that could generate important insights into the intrinsic service usage of our most vulnerable groups and hopefully effectively target service provision. However, it's important to note that data science doesn't just link data. It can link disciplines and researchers, professionals, knowledge and awareness. It can attain rich information that could help both the health and social care sectors attain their common goal of improving the future outcomes of these vulnerable groups. And let's not forget that it also has the capacity to reduce years of research to months, as has been evidenced in the last few months of the COVID health risks. As with all research methods, there are limitations to this approach. This quote sums it up well, I think. Data attained can only be as effective and efficient as the individual or individuals that design, analyse and interpret it. To further improve the accuracy and results of the data, it is integral that a multidisciplinary, joined-up approach involving expertise is an essential requirement for any future data science research project, particularly in the health and social care sectors. We need to ensure and interlink all the disciplines that are involved to ensure that the data that is collated is the right data that is reflective of the group being explored. It could also be suggested that it requires a change of mindset for all those involved. Most of us freely provide our information quickly to help improve or enhance new products and services. Therefore, we need to communicate this to our users, as now you know the potential and benefits of what that data can attain. It has the capacity to help improve services and not hinder them. Health and social care sectors have been separate entities for decades for various reasons. However, data science and big data can now begin to narrow that divide and amalgamate those sectors and link that information in more real time. All sectors, as we know, are intrinsically linked when it comes to providing these vulnerable children and groups with a service that meets their needs. Early intervention, as we know, can not only improve future health and social outcomes, but can reduce the need for future services. So with the aftermath of COVID now beginning to emerge, it is a critical time for us as a multidisciplinary corporate parent to utilise and explore this data to protect and safeguard the future of these vulnerable children. Thank you for taking the time to listen.